For the longest time, my weight has gone up and down, and as I get older, I realize I have much more that I want to do in my life, and I think my heavier weight was at a disadvantage.
Rick Gibson is a case manager and medical social worker at Portneuf Medical Center. After struggling with being overweight for many, many years and trying method after method of weight loss, Rick turned to someone he knew and trusted. Rick went to go see Dr. Alinian Garay, and together they decided on a plan of action.
They tell us very early on, one of the parts of the program is you spend 6 months being taught how to change your life, how to eat better, how to pay attention to your habits, both good and bad, and how to affect change there, because I envision the surgery as just a little blip in that whole process, a 5% of a 100% process. And so all of that teaching was very important. The best thing I found about this program is that it actually wants you to be in that program for many, many months and learn habits, develop a better way to live your life, then have the surgery and already have those habits in place.
The results were just what Rick had hoped for.
Well, simply go up a few stairs without being out of breath. I mean, just the little things you forget that were kind of a struggle. I mean, just simple things have been so much easier, weighing a little bit less from an activity standpoint, but overall, generally, emotionally, mentally, I just feel much more comfortable, much more confident. It's been a wonderful change for me.
Dr. Garay has been doing bariatric surgery at PMC for a little over 4 years. He's very passionate about helping people realize their dreams of losing weight and getting healthy.
This is really good for patients who are suffering from significant weight problems. Most of my patients are 50 to 100 pounds overweight, and most of them are suffering from medical problems like diabetes, high blood pressure, cholesterol problems, the things that will lead to coronary artery disease, which is essentially heart attacks and strokes and things like that.
Bariatric surgery isn't for everyone, and it is just one step in the process. Patients have to dedicate themselves to living a healthier lifestyle, and the Weight Management Institute is what keeps them on track.
The surgical portion is not just something that you do and then you're fixed. The surgical portion is a lifetime commitment. It's a lifestyle change. And yes, the surgery will get you where you want to be, but you have to be mentally prepared and emotionally prepared and physically prepared to the changes that are going to take place so that you can be successful long term. And other programs that don't prepare you in that manner can have a significant failure rate. At our program, we don't have a failure rate. All of our patients, every single one of them since I've been here, have been highly successful, lifelong.
Rick says that the reactions from his old friends are just one of the positive outcomes of the new and improved him.
It's been amazing. I haven't posted any pictures on Facebook, so it's been kind of fun to throw out a picture there and get some reactions from folks that I haven't seen or talked to for a long time. I have family all over the country, and so with reunions and gatherings and things like that, it's been neat for them to see me, and then friends, of course, and even in your own hometown, you don't see folks for months at a time, and I've had good results, and so it's been neat to run into them and have them say, "What have you been doing?" and what did you do this time? And so it's been neat to talk about the program and what it's done.